Okay, great. Thank you, Nicole. So today I'm going to introduce our first presenter. Please hold all of your questions until the end of her presentation. If you have a question you don't want to forget, enter it in the chat. We will ask her the question as soon as she finishes presenting. So our first presenter is Japari Kazama. She is coming to us from the Outreach and Education Department of the Detroit Health Department, and she is a registered nurse. Thank you so much for joining us today, Japari. How are you?
I'm doing well. Thank you, Portia. And thank you everyone for being here this morning. Today, we are going to discuss some of the updates that we have from the city of Detroit, specifically the boosters, as well as the third dose vaccines that are available, and as well as some locations that people can go get those shots. Natalie, next slide, please. All right, so as always, we really like to discuss the numbers and show you where we stand in the city of Detroit with regards to our case dashboard, case positivity and dashboard numbers. So we have seen a total of 56,743 confirmed cases of COVID-19 from the beginning of the pandemic in March of 2020 to the 28th of September this year. And in addition to that, we've seen over 2,373 deaths due to the pandemic from the beginning as well as to the current situation now. With regards to our positivity, this is always a number that we're constantly looking at because we need to know how many cases are coming back positive, what that percentage is. And so on the right side of the screen, you can see where we are in Detroit at 4%. So that means the number of tests that we take every day or within a given period of time, 4% of them are coming back positive with COVID-19. You can see that our neighbors a little bit slightly north to us, northeast, MiCHWA is at 9%. Oakland is at 7%. Wayne South is at 7% as well. And this is just for you to be aware of what's going on in those areas. Be mindful that there might be more transmission in those places, but as well in our city, we need to be mindful. The state of Michigan as a whole is at 9%. So this actually shows that Detroit is below the average. That's awesome. That's really good. And we're encouraged to see that because one time at some point this year, we were over 20% at a certain point. But now we're really low and we want to keep it that way. Next slide, please. So this is the vaccination dashboard. We always like to share this information as well that shows where our vaccine numbers are at. You can see Detroit is about 44.7% vaccinated, so shortly under 45%. So we're not quite 50% vaccinated, but we know that people are taking things seriously, such as mask wearing, hand hygiene, social distancing, and things like that. Our neighbors above, Oakland, MiCHWA, Outer Wayne, they're above 60%. Oakland is above 72%. MiCHWA is at 70%. The state of Michigan is still at 62% vaccinated. We kind of want to get to 70%. I mean, that's just one of the numbers that kind of has been thrown out where we would get to community immunity, even though with the Delta variant strain, we know that that percentage of community immunity probably needs to be a little bit higher. And I do want to apologize. We're currently out in the community doing some education at one of the schools. So apologies for some of the external noises you're hearing. I think their students are going between classrooms right now. Next slide, please. So this is our level of community transmission. This is just one of the indicators that we use to understand what's going on and basically provide suggestions and guidelines for our communities. Currently, we know that the city of Detroit is at high transmission. So that means that over 100 of our number of cases are coming back positive over the last 7 days, over the last week. And we know also that in these communities that have high levels of transmission, it is highly encouraged to wear a mask indoor to prevent the spread of the virus. This information is available on the CDC's website, and people can look it up and be able to know what other regions or cities might be at in their levels of transmissions. We get a lot of calls from people from out of state trying to understand, what's going on in Detroit, what's going on in Michigan, and we just let them know it's high transmission and, encouraging them to wear a mask. Next slide, please. All right, so we're going to talk a little bit about variants because we're currently going through a phase of this pandemic where we're having a variant that is really more transmissible, and this is the Delta variant. So just for everyone to be on the same page, viruses continue to mutate and change over time. Viruses make copies of each other. And I know we've had this conversation in multiple sessions in the past about how the COVID-19 virus attacks our cells and starts to make more copies of itself. Sometimes those copies that it makes are not as good copies. So those copies, they die, they're weaker. But sometimes the virus does have an opportunity to make a stronger version or a slightly different version of itself. And that version or variant may spread easier. It may be able to cause severe illness or more illness. And then also it may be able to bypass some of the vaccines we have, some of the therapies or other tools that we have for the COVID-19 pandemic. So Delta is one of the variants that we're currently dealing with. Over 99% of the cases that are coming back positive in Michigan are due to Delta. So it's become the dominant strain. And we know for a fact that Delta, in the next slide, is able to spread more. So for example, in March of 2020, the original COVID-19 strain, an infectious person could possibly transmit it to 2 people. Now with Delta, it's doubled. The person that has Delta might be able to transmit it to up to 4 and 5 people. So that's the thing that we have with regards to this strain. And so it's highly, highly more important now that you wear a mask because you don't know if you're one of those people that is carrying it. And as we know, as we discussed, vaccinated individuals can carry this strain. However, it's not as transmissible due to the vaccine, but it can still happen. And also wearing a mask that is tightly fitting to protect yourself and prevent yourself from contracting it as best as you can in case you're around someone that potentially has the Delta strain. Next slide, please. All right, so I tried to update our myths and misconceptions about the vaccine to most of the current myths and misconceptions people are hearing about. So the first one that we hear a lot of is COVID vaccines mess with your DNA and there's a microchip in it. This is not true. We know that the vaccines do not have that ability to alter the DNA because it's not entering the part of your cells that houses the DNA. And in addition to that, there's no microchip. A lot of these rumors and this might come from some, story or a little bit of truth, I want to say maybe, to what might have been said in the past. So with regards to microchips, what I understand is Bill Gates had talked about potentially, having a way where we can keep an eye on people who are from foreign countries or people who are displaced or refugees that might not have current vaccines. And we needed to find a way to keep track of their vaccine records. I don't know where the conversation about a microchip came into play, but I know that there was a conversation regarding people from countries that are having turmoil or war that would have people going into other countries in Europe or Americas. And we needed to keep track of their vaccine records. And then it evolved into a microchip. And now here we are with the COVID pandemic talking about microchips. The vaccine will make you infertile. We've actually talked about this in the last presentation. We talked about where that myth came from with regards to Dr. Wolfgang. It doesn't make people infertile. Matter of fact, if it did make people infertile, we know that we would have seen that way earlier, way before vaccines were created, because of the antibodies that are created from people who actually contract the disease and survive. Women that contract the disease and survive still make antibodies, and their antibodies are not making them infertile or attacking them. The third one up here in this top corner, vaccines don't work because now you got to get a booster. Well, that's a that's one that you know, a lot of people have been talking about very recently. We know in regards to the boosters that over time we've seen in some of the studies, and especially in studies from Israel, that over time the antibodies, your immunity wanes. It's called waning immunity. And we encourage a booster for people who are at risk, and we'll talk about boosters specifically. But we know that there are other diseases that your antibodies wane over time, and we do need to get a booster every couple of years or so. So it's not that the vaccines are not working. The vaccines are built to prevent severe illness and prevent death, and they're able to do that. So technically they are working. However, over time, they do encourage getting that booster. Down at the left corner, there have been many reports of adverse events from the vaccines. We've talked a little bit about VAERS before, the Vaccine Adverse Event Reporting System, which is basically a surveillance system that the HHS, Human Health and Human Services, uses to see if there are any reports on adverse events from vaccines. And a lot of people might experience something shortly after receiving a vaccine. It may have the vaccine may have caused it, but at the same time, we don't know that it may not have caused it. So a person might have died shortly after receiving a vaccine, and that gets reported into VAERS. However, unless you're looking into that person's chart and seeing exactly what went down, you know, perhaps that person had a heart attack, and you wouldn't know unless there was a heart cath done or there was some tests that were done. You know, they took an EKG. You might not know that all of that was in play, and it just so happened that they had received a vaccine 2 days earlier. So VAERS is a great system for us to keep an eye out on things and to see if there are trends, but at the same time, it might not be the full picture. Number 5 there, middle in the bottom, there's no point in getting the vaccine if you can still catch COVID. Well, I have coworkers that have been vaccinated and have still caught COVID. And a lot of them, that, as far as I know, every single one of them had very mild symptoms. They've explained it as it felt like a common cold. It felt like it was just a cold. And some people have even expressed that if it wasn't for the fact that they had gotten the vaccine, they think they would have had a negative outcome from COVID. And unfortunately, you know, even suffered and died. But these vaccines minimize your risk of getting severely ill, minimize your risk of dying. They don't completely eliminate the chances of you catching COVID, even though they reduce that risk a lot. But when you have strains like Delta that are circulating, that are more transmissible, then it's going to start getting into people who are vaccinated. And finally, the last one, the vaccine will give you COVID-19. That is not true. That one we know for a fact is not true because COVID-19 vaccines do not contain any physical component of the germ. They do not contain you know, any part of it. It's only that message, that recipe that tells your cells how to build that specific part of the COVID-19, that spike protein. And in regards to catching COVID, the vaccines help prime your immune system to be able to defend itself. If you ever caught COVID, it will be able to recognize it and fight back in that situation. Next slide, please. All right, so here we are. Now we're going to talk about third dose vaccines and booster shots, because there's actually a difference. So a few weeks ago, the CDC and the FDA came out and said that individuals who are moderately to severely compromised need to get a third dose of the vaccine after their second dose. So we all know that Pfizer and Moderna are 2-shot vaccines. Johnson & Johnson is 1 shot. Now, what happens is people who are severely immunocompromised need their immune system. As we've said in the past, your immune system works hand in hand with vaccines. And so their immune system actually did not kick into action as much as it needed to. So these severely immunocompromised people or weakened immune systems didn't have that response, and therefore their antibodies might not be as strong or as readily available as with someone who is not immunocompromised. So it is encouraged that these folks go and get a third shot 28 days after their second shot or their most recent shot, and not before 28 days. So an example of a third dose vaccine or a series is the MMR vaccine. This is a measles, mumps, and rubella vaccines that the little kids receive, or the babies. It's a series. You get one shot after, I think, 6 months. I don't know what the schedule is exactly for children vaccines, but you get them after several months because it's priming your immune system. And after you've received all your series, you should have adequate amount of antibodies to protect you. Booster shots, on the other hand, we just got the announcement from the Health and Human Services again with the CDC and FDA stating that individuals can go and get their booster shots because they might not, because over time their immune system began to wane. So their antibodies, their immunity is not as strong over time. And here in this case with COVID-19, it's 6 months after their second dose, after the completion of their second dose, they can go and get that booster shot. But there's caveat to that. The Pfizer vaccine is the only one at this time that we're giving booster shots to. So an example of a booster shot is the Tdap vaccine. The Tdap vaccine is the tetanus, diphtheria, and pertussis. So we are supposed to get that vaccine every couple of years. I believe 7 to 10 years is the appropriate amount of time. So if you haven't gotten your Tdap within that time period, please go seek out, because we know that pertussis is making a comeback. And pertussis, by the way, is the whooping cough. So that's an example of a booster shot. You get that every couple years because over time you have a waning immune system. Next slide, please. All right, dive in a little bit deeper. So third dose vaccines. Who should get it? People with moderately to severely compromised immune systems. Why are they getting it? Because these folks did not build up enough immunity in the 2 shots that was originally given. What vaccines should they be receiving? This is only for Pfizer and Moderna. Currently, Johnson & Johnson does not have a 2-shot vaccine that is authorized for use, even though they have one that's been studied, but we don't have that guidance yet from the FDA. So just one more time, if you're immunocompromised, this third dose is, you need to go get your third dose for Pfizer or Moderna. And I wanna say that examples of immunocompromised people are the following: folks receiving cancer treatment, folks that have had an organ transplant and are on special medications that actually suppress their immune system, folks that have had a stem cell transplant in the last 2 years, individuals that are taking medications that purposefully suppress their immune system, so like corticosteroids, moderately to severely immunodeficiency. There's specific diseases, hereditary type diseases that might lower a person's immune system, advanced or untreated HIV infection, and the folks receiving high doses of corticosteroids or other drugs that suppress their immune system. Next slide, please. And then with booster shots, basically there are 3 groups of people that can receive the vaccine. And our mayor made a statement yesterday with our chief public health officer about this booster shots and where you could get them. So booster shots are available for Detroit residents 65 years and older, as well as Detroit residents 18 years to 64 who have a who are at risk for severe COVID due to an underlying condition. And then finally, individuals 18 years or older who work in Detroit or live in Detroit and within an occupation that puts them at risk for high exposure of COVID-19. And we'll get to that in the next slide, but I do want to make a last comment. Booster shots are only for folks who receive Pfizer, and it's 6 months after the initial completion of their first dose. So 6 months ago was March 30th. So if you received your vaccine prior to March 30th and you received Pfizer and you fall into one of these categories, or you know someone that has, that person or yourself is eligible for a booster vaccine. Next slide, please. All right, so what are occupations at risk? First responders, we know they're at risk. Fire, police, EMS, long-term healthcare, so nurses, nurse assistants, doctors, folks that work in long-term care facilities, medical aides, education staff, teachers, daycare staff, support staff, food and agriculture. These are our people that are first liners, manufacturing staff, corrections, postal services, public transit, and grocery stores. And this is according to the CDC and the Detroit Health Department. Next slide, please. Underlining medical conditions. So let's say you don't fall into any of those categories. Other conditions or other people that are over the age of 18 that have any of these conditions can get a booster shot. Cancer, chronic kidney disease, chronic lung disease, so asthma, fibrosis, pulmonary hypertension, folks with dementia or other neurological conditions, strokes, diabetes, type 1 or type 2, Down syndrome, heart conditions, all sorts of heart conditions, cardiomyopathies, hypertension. Sorry, skip 8. I don't know why that did that there. Number 9 is HIV. Number 10 is for immunocompromised or substance use disorders. 11, liver disease. 12, overweight or obesity. 13, pregnancy. 14, sickle cell. And 15, smoking. So those are medical conditions according to the CDC that puts a person at risk of needing a booster shot, but only for Pfizer. Next slide, please. Vaccine eligibility, as always, we encourage you all to make an appointment or even walk in. The vaccines are available for people 12 years and older for Pfizer only, but Johnson & Johnson and Moderna are for 18 and up. You just need to call to schedule your appointment if you would like, which is 313-230-0505. Next slide, please. I want to talk about the third dose and booster locations that are open. We provide vaccines 7 days a week, every day. So on the left side, far left side of the screen, you can literally walk in between certain hours of the day to these 5 locations. In the middle are weekday appointments. So at TCF, you do need to schedule an appointment, but it's available from 9 a.m. to 5 p.m. And on the far right corner, these are our our community Saturdays, as well as our Sunday, which is Triumph Church on the East Campus, where we're providing vaccines from 9 a.m. to 1 p.m. You can walk into any of these sites, or you can call to schedule an appointment. Our number is 313-230-0505. Next slide, please. With regards to minors, I just want to make sure it's clear, because a lot of times people don't realize that with minors, you got to do things a little bit differently. Just making sure that there is identification for that minor, and the consent form needs to be signed. With regards to our Good Neighbor program, we are not reimbursing people that bring in minors for that program, but we're reimbursing for other folks, your neighbors, your friends, family members that need a ride. Next slide, please. And also, we are able to come to people's homes and provide the vaccines for home visits. So anyone that's at home, or all the individuals that are in that home, will receive a vaccine. A nurse will come and identify themselves. The appointment is about 30 to 45 minutes, because we do monitor people after the vaccine, and the nurses can also vaccinate other folks in that home. Next slide, please. And then finally, this is about the Good Neighbor program that we encourage folks to enroll in. You do need to pre-register to be a good neighbor. So if you have friends and family members, This could be some gas money for you. Gas prices are still kind of high, especially for folks that are driving trucks, myself included. But this is just a program where you can bring in a person that maybe needs a ride to a vaccine site, or needs a support person. They get $50 gift card for every shot, every person that is brought in. But you do need to pre-register for that program at our number, which is the 230-0505 number. Next slide, please. And finally, I always say this is the spur of the moment type of option. So if you need to text somebody, if someone is looking for a site nearest to them, and this includes all sites, not just the city sites. So this is CVS, Walgreens, Rite Aids, mom and pop pharmacies and things like that. You can text your address, your immediate address, to 313-217-3732, and it'll give you 3 of the nearest vaccination locations to that address. Next slide, please. All right. At this time, I do want to open it up for any questions related to just what we just discussed with regards to booster shots and the vaccines. I apologize that I do have to exit early, but if anyone has any questions, please unmute yourself or put it in the chat and we could discuss. I know it's a lot of information. I try to make it as clear as possible, but if you ever have questions, you can always call us. And Portia, we can definitely send you these slides as soon as we're done this presentation today.
Okay, great. Thank you so much for your presentation today, Japari. Always insightful, always incredibly beneficial. I don't see any questions in the chat, but does anyone have a question for Japari before she has to leave us and go join all the children? Okay, well, great. There don't seem to be any questions, but we will forward you a copy of this presentation as well as a link to complete a survey in order to get your CEUs and directions on how to create an account to create your CEUs if you've never done that before. So thank you very much, Japari. Enjoy the rest of your day, and we look forward to seeing you soon.
Thank you all. Stay safe, everyone. Bye-bye.
Okay, well, Japari's in for an exciting adventure for the rest of the day. Those children sound very enthusiastic. So we'll wish her the best of luck. And then moving on to our next presenter, I'd like to introduce Natalie Foreman from the Detroit Health Department. She is in the Department of Behavioral Health, and she has a Master's of Social Work. She's an LMSW, and I'll hand it over to her. Thank you for joining us today, Natalie.
Thank you so much. That was really super sweet. Yeah, Japari gives a lot of great information. If you guys can ever make one of her 2-hour presentations, you'll have questions. But in the meantime, I would like to talk to you guys a little about mental health as employees and how to deal with that stress in the workplace. So we're going to get into it just to keep your time going. So I want to talk about what the reality of the situation is, right? We're in the middle of COVID. It seemed like it was getting better, and now we're not sure. You know, it hit us all at once. And at first we were like, oh, okay, we're staying home. We're going to get a little break. And then we started to really see what was happening in the world. So the reality of the situation is that you might be stressed, that you might be feeling not heard, that you're feeling like things are overwhelming. I promise I'm not just going to talk about depressing things. It does get better. And that's why we're here as well, is to kind of help you navigate through it. Because when you are looking at it as just one person in the world, with all these things to deal with, we want to help you kind of compartmentalize them and break them up so they're a little easier. Oh, wow, this slide came out small, didn't it? All right, bear with me while I zoom in myself. So one thing that we're noticing and that we've been getting a lot of requests for are that many workers are feeling kind of this abrupt change in their lifestyle. And not just at work, but probably most apparent at work, seeing as that's where you're spending a chunk of your day. And now we're either at home working, we're at the office, and maybe we don't feel like it's clean enough. Even if it is, it's a normal thought process to go through. And one thing that's really nice is that we have lovely people like Ms. Portia who'd like to put on things like this so we can answer questions and talk about it and have dialogue, which is extremely important to keep doing. Keep talking, keep asking your questions, review your PTO time, review what your policy and procedures are so you know how to prepare yourself and your emotions. as well as at home. You know, we talk about back to work, that's clearly kind of what we're doing, and we're talking about vaccines, but that doesn't mean home life got easier. That doesn't mean we're not going to talk about it. You know, there is a sense of a lack of control. You know, things and decisions and mandates are being put in place without our really asking. And we have to follow them regardless. Being told that, no, you don't have to wear a mask. Yes, you have to wear a mask. Oh, no, it's okay now. No, it's back to being bad. You have to wear it again. It can cause a lot of chaos in your mind, and it can cause a lot of different thoughts and feelings to arise that maybe you weren't prepared to have. So things like depression becoming higher, anxiety becoming higher, stress levels becoming higher, they come with consequences, right? And when we think of those consequences, we think of a lack of sleep. We think of gaining or losing weight that we did not plan on gaining or losing. I know I'm on the gaining side of that end. And we kind of start to feel maybe this ball, like this ball of spiraling ball of emotion, out of control. And maybe not so much out of control, but grasping back for it. Part of going to work is hopefully something you can control and hopefully something that you have a say in. You know, this is your workspace, and this is where you're going to have your time to do your passions, your things, your jobs, your projects. And though the state of Michigan is opening back up, you know, restaurants are becoming more lively. We just got through kind of the summer. We're going into this fall where we're having like our Michigan-y things and our different fall-based things, apple picking, whatever it may be. We still need to be realistic that COVID-19 cannot safely become our new normal, if that makes sense. That I think a lot of people become comfortable with it. And our new normal is COVID-19. And unfortunately, even though we're very happy with behavioral health to see that people are adjusting and they're resilient, we don't want this to be the standard. And we don't want it to be a standard because it doesn't seem to be what's best for our mental health. Becoming isolated at times, only going out in specific situations. We want these things to be happy all the time and not an event that maybe, the word I'm looking for is, we don't want every little thing to be a major event, because then those little things become less special, if that makes more sense. We want people to continue having their sense and their reality oriented to the situation, which is we still need to wash our hands, we still need to wear masks if you're going to be around a lot of people, and especially if you know they're not vaccinated. Now, I do want to say, and I'll speak for Japari as well, because I know we've said this in the past, is that we are not here to tell you to get vaccinated. You know, that's not our job. You know, as much as we want to tell people that, that's not the value we have, and it is your choice. And if you decide not to, you decide you're never going to, or you're dealing with somebody that you as a vaccinated person are dealing with someone who is unvaccinated, we're just here to give you education, help you guide. You know, we want to make sure that you go in with all the right decisions, and that if you do not vaccinate, that we can keep you safe too. We never stop caring about you just because you didn't get vaccinated. Never, 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 never. Last little thing on here is that following these protocols, following these practices, these tips from the CDC, even though they are a little fluid and they are ever changing, it can cause trauma. And we understand that as folks, like as human beings who are constantly in search of balance, you know, kind of staying right here in the middle, that changes can send us way up and they can send us way down. And we want to make sure that we give you these skills to stay in the middle. So what we're going to talk about next, and staying in the reality of that situation, is that I want to talk about what's called, like I've said already, reality orientation, right? Kind of like these preparing yourself for the common work-related factors that will add to your everyday stress. We just mentioned people who we know aren't vaccinated and then maybe ourselves are. That can be stressful, as well as not being vaccinated and being around people who are vaccinated can be stressful. I'm not saying one is better than the other. I'm just not. It's just important to keep in mind that we can't change other people's opinions necessarily, and maybe it's not for us to take on that stress to do so. So just having that open communication with your superiors and your supervisors, making sure that you feel heard, making sure that when you go home for the day and your work is done, even if your work is home, which it is for me, you have a safe place to go, you have a calm space to go, and you can kind of think about those thoughts and have them. You're entitled to your thoughts. You really can't control your first thought, right? It's how we react to them. You might have concerns about being exposed at work. I know some people, we've had actually quite a few people, not some people, who have expressed going to work is scary after not being there for a while, or it's been scary this whole time. I'm not sure maybe what the individuals in this this PowerPoint are going through, but just to cover both, I know for me, going back to the office was a little scary, and I didn't think it would be. I didn't feel any anxiety until I was in the building, and I went, ooh, I'm not used to this anymore. The point that I'm trying to make is that change is scary even when it's a good thing. Regardless, you're out of your new routine that you worked very hard to maybe develop. And we just want to validate that. We want to validate that it is scary to go back to things, even if it was something that we were really looking forward to. Some things you can do, some things I would recommend is that if you are feeling like it might be unclean, that you're risking your exposure, carry some cleaning supplies in your car. I do that. And at first I was like, that's silly. That's over dramatic, isn't it? No, felt a whole lot better when I got to work, and I thought, okay, at any time I can make my space and my little bubble cleaner. I have control. And the whole point of feeling unsafe, unstable, anxiety, depression comes from this feeling of not having control. And that's the goal in COVID-19, is that you got a lot of your control taken away. You couldn't go certain places. You were told you couldn't do certain things. But I want to make sure, and the health department wants to make sure, and I know Jafari wants to make sure that you guys feel like you have some of that coming back if you don't already. Workloads are different. We kind of went from maybe a little dip to a lot, or we went from a lot to maybe a little dip, or we've stayed kind of in this same little balance. And if your workload has changed, just coping ahead with it. Reminding yourself, okay, I have tasks to do, and this is how I'm going to get them done. And maybe your brain doesn't work like that. Maybe that's way easier said than done. So we have to figure out some strategies that work for you. I would show you my house, but I have sticky notes everywhere. I'm looking around right now. I have sticky notes on a lot of different walls reminding me what to do throughout the day, because my environment changed, my workload changed, my tasks changed, and I wasn't in my secure routine. For me, had to come up with a system that would constantly remind me of what I was doing. It worked, and my anxiety went down a little bit. And we're here to help you manage some of that. If you have any questions, you can email us. I'll give you the email at the end, and we can kind of figure it out together. For the sake of the time of this, I'm not going to go through every example that I can think of, but I do want you guys to know that there are options, and there are resources online that kind of help you. You can create a toolkit, almost like a tool belt of coping skills to pull from. Lack of access to the tools and equipment needed. Again, I bring what you can. That's why I talked about having cleaning supplies in your car, having an exit route, talking to your superiors and your supervisors about, hey, I might have to leave because I might get anxious, and being honest and upfront about it. That way, when you leave, if you leave, it's not a surprise. There's no misinterpretation of it. You've said clear as day, these are my boundaries. This is what I need to work with. And understanding that your future at your workplace and your employment, even though you feel some uncertainty, getting clarity on that as well. COVID brought a lot of uncertainty. I know a lot of us didn't think we were going to have jobs. A lot of us thought that we were going to get our cut paid. Millions of other really distraughting thoughts came through our minds. So for these last couple bullets, it's a lot about clarity and a lot about setting those boundaries with your employees and your employers, creating that relationship that's cohesive and says, hey, I want to be here. How can we make sure this happens? And if it's out of our control, how can we communicate it effectively? And then having a plan, always having backup plans. It seems at this point that with COVID, things have kind of hit again, I don't want to say certainty because you never know, but there are some guidelines in place now, right? We have some fallbacks happening. And just like with policies and just like with laws, your own personal policies and your own personal laws need to have guidelines and backups as well. Learning new communication tools is very important. I mean, we've all had to learn Zoom. I hated this at first. Now I love it because I know how to do it and I know how to talk through it, and dealing kind of with those technical difficulties that come with it. And on the end of that, returning to that face-to-face can be scary. Returning to going from Zoom, being able to mute, being able to turn off my camera if I'm having a moment, I just need to eat some food because I don't want to do it in front of people, or I need to take a breath, or I need to zone out for just a second because whatever we're talking about is too much. Can't do that in real life. You can't just shut your eyes and tune somebody out. It's a little rude. I don't think people appreciate it, but we can teach you kind of some nice ways to cope with that. We can teach some deep breathing skills, some skills that you can do in the moment that no one needs to know you're using. If you guys are up for it for just 1 second, let's just do that together. Let's just take a deep breath in through our nose and hold that breath. And long breath out. Perfect. I think that's the best coping skill there ever is, because no one really needs to know you're doing it. It's something you do anyways. It just kind of lets you settle back into what you were doing. That was really nice that you turned your camera on. That was very sweet to do. I loved that. So we'll kind of move on from there, but just remember, if at any time you need to take another deep breath, I'm not going to know what you're doing really. I'm just going to think you're breathing. So pre-planning, right? I talked about coping ahead a lot. That's one of my favorite terms, is that if I am going into a situation that I know might elicit an emotion I don't want, I want to think about it before I have it. I don't want that emotion for you guys or for myself to kind of hit me like a wave that I didn't know was coming. I rather know. And the example that I used pre-COVID was funerals. You know you're going to go to one. We all know how funerals work. We all know when we go, we're going to feel sad. And instead of saying, no, I'm going to be fine, I'm going to be fine, I'm going to be fine, and then walking in and breaking down, better to go in with a little sense of, I know this is coming. I'm feeling a little more comfortable with it. And I think the same thing goes for COVID, and it goes for sickness and pandemics and all this other fun stuff we're dealing with right now, right? And reaching out to our employers, reaching out to them before returning to work can help us ease that anxiety. It can help us kind of get those concerns off our chest that maybe we thought are very dooming and have just been kind of ruminating in our heads, when maybe our employer has some solutions in place and they've actually been thinking about it too. They might be able to give you a solution to a problem that you thought had no end. And that's completely normal. I think as human beings, we tend to do the what if, what then, when there we have all those good things, you know what I mean? But just like we're human, our employers are human, and they're thinking about those things as well. And just like employers, your employees are thinking about those things as well. It goes both ways. So we both need to be very communicative with each other. I know that a lot of people have some stress leaving their kids at home, and they're dealing with that anxiety of, am I not giving my kid enough time? Am I risking my kid's health by sending them to daycare? So doing the walkthrough, having the babysitter come over a couple of days in a row just to do a quick glance of the house. That's just a specific example in case there are any parents in here dealing with that. We also really want to normalize these feelings. And I'll tell you over and over and over again, as much as you want, that your feelings or anxiety is so normal and it is so okay. I would be a little worried if you weren't. I'm just kidding. I would be proud of you. But I'm also proud of you if you're anxious. Talking about feelings and letting them out, letting them be uncomfortable, being in that moment of a tough topic in itself is therapeutic. And I know I say that to you guys as a therapist. And I know I say that to you as someone who is like bouncing around all giggly and smiling and talking about things that are a little tough. But it comes with practice, and I understand that. And I encourage you to keep doing it, even if it's just to yourself, venting out loud, journaling, writing down your concerns and throwing them out, tearing them up. You know how people write letters to people they hate and they want to swear at and they want to go off on, and then they burn the letter. It's not about what you say, it's about getting it out, right? And with your employers and with your supervisors, letting them know how you feel going into things so they can be with you on that boat. I say a lot to my people, you have to feel your feelings to heal them. And if we push our anxiety down, or our depression down, our worry down, whatever word you want to use, it's still there. It never went away. But now, instead of being anxiety and coming out like it was organically supposed to, it's going to come out as different things to try to get you to talk about it. Your body and your mind are constantly working together, and they'll find ways to make you feel things. That's when we get isolation. That's when we get substance use. That's when we get not showering and our kitchen's a mess and we haven't done laundry in 15 days and things like that, because we aren't letting ourselves feel our anxiety. So it's going down. We're not letting ourselves feel our depression, so it's going down. It only has so far to go. And our body goes, okay, well, he's not acknowledging that. Let's try something else. And it comes up as a bad habit. I don't know if that made sense. I hope it did. That's the best way, I think, to describe it, is that you have to feel to heal. And COVID-19 is a time of healing. Let me tell you, we have people who are getting sick. We have people who are feeling down. We have people who are completely healthy and still having issues they've never had. So we'll feel them with you, and we will help you navigate through those feelings the best we possibly can. There's a lot of talking I'm doing. I'm trying to get a lot of this in because it is important. So bear with me. And if you need me to slow down, feel free to put your camera on and go, you're talking too much. Because we all know this pandemic, it took a lot out of us, and it took a lot out of our workers as well. People became feeling powerless. They felt overwhelmed. And what happens when those things happen is that we lose productivity. We lose the motivation and the drive we have for our jobs. And I know I'm coming up on time, so let me skip ahead to the next one as well, as these are extremely little. Part of pre-planning, coping ahead, like I like to talk about, is working through those mental health resources that you have in your workplace. Talking to your HR, talking to your supervisors, and making sure they have what you need. And if they don't, that might not be their fault, and that's okay. It might just be time to work together, or work with us, or by yourself, or family, or friends, to find what works for you. So kind of exploring your options in and working out, right? Identifying the things that you have control over and being okay with the things you don't. And again, that comes with practice. This is a really nice thing that your employers are putting on right now, and that the city is able to come and do for you and for anybody in general. I don't mean just you, but anyone in general, to be able to have these little sessions. Even if you don't walk away with a ton, which is understandable, it's nice to know that someone's in your corner, and I hope that this is how you feel, because I really hope you feel the city and your employers and your people are here with you. When you go back to work at your pace and at your time, just remember these things, that you might be burnt out and tired and overwhelmed. You might be depressed. You might have trouble concentrating, and we're just here to remind you it's normal. Even though it's normal, we still want to change that, okay? And we still want to help you get through it. Feeling anxious, feeling nervous, all these things come with it. Being mindful of each other and being mindful of different opinions, and being mindful, again, like we had brought from the beginning of talking about vaccinated versus unvaccinated to now, that's just how it goes. Everybody's going to be a little different. So we're going to try to respect each other and not butt heads. And if you feel that pressure, you feel that need, like you need to say something, there are ways to say things in nice ways that don't intimidate or don't become aggressive. And if you find you're in that situation, pull yourself back and let's reevaluate and reprocess together, okay? Stress management, we want to talk about just some little things you can do. The deep breathing, that's the one I always say. That's always going to be my default, but find what works for you. Find your circle, learn your time management skills that work best for you. Body and mind, when you have a busy body, you have a calm mind. Keeping your body busy, exercising, cooking, moving around, cleaning, taking a walk, taking those 5 minutes a day for yourself, just to be by yourself, away from your husband, your wife, your kids, your grandparents, parents, whoever it is. And just breathing. Just being with yourself, right? And these were some things that Japari was going to talk about in terms of HR and COVID. Unfortunately, she did have to go. But I'll leave the resources up here for you guys so you can look at them as I open up the floor, and so that Ms. Porch tell us if there's anything else we need to do. But I'm here for questions if you guys need.
Okay, great. Thank you very much, Natalie. I thoroughly enjoyed your presentation. In yoga, we agree that you have to feel to heal, and we say the only way out is through.
Yes.
So you have to experience it, because if you don't deal with your issues, then you will have issues in your tissues. And so that kind of goes along exactly with what you were saying. So I agree 100%. I don't see any questions in the chat. I'm going to give everyone an opportunity at this time to ask any questions that they might have. Not a lot of questions today. So much good information. We have resources. I'd like to ask Natalie if she'll share her presentation with me, or be willing to allow me to share it with our participants.
Yeah, absolutely. 100%.
Okay, great. So that means that after this webinar, you'll be getting an email that will contain Japari's presentation, Natalie's presentation, and then also a link to complete your survey in order to get your CEUs, and a list of instructions on how to do that. For those of you who have created a Canvas account before, you will not have to go through the first set of steps. You can go right to step 7, and it'll tell you that in the email. So what I'm going to do now is I'm going to share in the chat. If you have any questions, now is the time. We're almost finished up here. So I'm going to add this link in the chat. If you have created a Canvas account before, just go ahead and skip straight through to the survey. If you have not, very quickly, you'll need to register and enroll, create an account in Canvas, and then enroll in this course. We've sent you those directions. I put the link to the survey in the chat. And if there are no further questions, I'd like to thank everyone for joining us. If you would like to take yourselves off of mute, turn your cameras on. It's just an option to say goodbye to everyone. We're going to give you the gift of 5 minutes of time back today. And maybe that's the only 5 minutes you have for lunch today, if you're joining the Michigan Health and Human Services Department lunch meeting from 12 to 2. So any other questions, comments, concerns? If not, I think that's it for today. Thank you for joining us, Natalie. We really appreciate your time, and we would love to have you back. Do you have a specialty that you deal with besides behavioral health? Any certain chronic diseases in particular, or anything you're passionate about?
Yeah, so I work, my degree is in veteran care, so I work specifically with veterans and their families, as well as substance abuse, mental health, and I come from a background of inpatient psych. We also specialize in I also do meditation Monday through Thursday with the health department, and I can send that link to you if you'd like as well.
That would be great. Send that over. We'll send that to our CHWs, and I might be reaching out with you in the future for another webinar, maybe on how to deal with our veterans, which is very important. We've got a couple of different veterans holidays. It might be nice to time something around that.
Yeah, that would be great. Thank you for having me.
Thank you for coming. Thanks to Japari. Tell her we appreciate her time. We know how busy she is and how busy you all are at the Detroit Health Department at this time. So anytime you do share is greatly appreciated. Thanks everyone from MiCHWA. My name is Portia Fisher. I'm joined by Nicole Holtz, and we wish you guys a happy and safe week, and we'll see you next time. Bye-bye, everybody.
Thank you.